Vaccines are very safe for all people, but definitely for young women as well. The vaccines have undergone the same studies and safety data that all vaccines have. The reason they have an emergency use authorization is because they only have 2 months of long-term data as opposed to 6 months, which is what it usually requires for a regular authorization. Well, so there's two different main types of COVID vaccines. The Moderna and Pfizer vaccines are mRNA vaccines, and they have not been linked to the clot risk that the Johnson & Johnson has. The mRNA vaccines actually show a recipe to your cells, and then the cells know how to make the antibodies against it, and then the recipe is gone. So it's not incorporated into your DNA, it's not incorporated into your body, it's essentially just showing a recipe and then gone. The Johnson & Johnson vaccine actually has a type of virus in it that has been deactivated so it doesn't make you sick. It's called the adenovirus, and that is the one with the Janssen in Europe has also been associated with a very small risk of clots and low platelets. The risk is incredibly small. It is the vaccine, the Johnson & Johnson, had 6 of those clots in 6.8 million doses. But they just had a pause so that they could look and make sure that there wasn't anything else they needed to be doing. Now, the risk of that type of clot with COVID infection is actually higher than the risk of what you would get if you had the vaccine. So the original studies that they released did not include pregnant or lactating women in them. And so the original data, we didn't have any long-term data. Since then, they've actually given this vaccine to multiple thousands and thousands of pregnant women. And the safety data really looks very good. It does not cause any significant problems with pregnancy. We do know for people who get sick with COVID, the actual COVID infection, they are about 20 more times likely, if they're pregnant, to end up needing ventilated or in the ICU or sick. So it is a known risk to get COVID while you're pregnant. The vaccine, again, is if we're showing you the recipe and then your body can make the immunity response that it needs, actually does a really good job of protecting people. And there are more and more studies coming out showing that the immunity can be passed through the placenta and also through the breast milk to help protect the baby once it's out.
You cannot get the virus from any of the vaccines that are available. None of them are live vaccines. None of them have a live virus in the vaccine. So women who are breastfeeding, I think, again, it's a very individualized decision. So if you're somebody who is working around a lot of other people, that you're at higher risk for acquiring COVID-19, or if you have medical risk factors, I definitely think, it's something to consider. Again, pregnant and breastfeeding women were not included in those original studies, but there is research that's ongoing that's very encouraging that it is safe for the babies, and actually women who have been vaccinated have been found to pass antibodies to the breast milk and theoretically also the babies. So in that regard, women who choose to get the vaccine while breastfeeding may actually be protecting their babies as well.
So we certainly are encouraging everyone to consider getting the vaccine, especially younger people. Younger people, though they may not get very sick with the actual disease, can still be carriers and pass it on to other people in society. So the more people that we have vaccinated, the less virus we're going to have around. And there certainly are people in the society that cannot get vaccines. For example, people who are immunocompromised because of certain medications, maybe some cancer patients getting chemotherapy. Newborns don't have all of their vaccines. Obviously, kids are not being vaccinated for this right now. And so, again, the more people that are vaccinated, the less likely we're going to see other people getting very, very sick.
This is not true. So there was actually a rumor that had spread on social media, and it has been scientifically disproven. And also, we consider infertility or subfertility after 12 months of trying to conceive. And if you think about it, the vaccines have not been available to the public for 12 months yet. We have patients who have received the vaccine and have gone on to become pregnant, and there are ongoing studies on this, but no, this is not true. Yeah, so when I'm talking with women in their 30s and 40s, especially after everything that came out recently with that slightly increased risk for that very unique type of blood clot associated with the Johnson & Johnson vaccine, I'm going to recommend that they try to obtain one of the mRNA vaccines if that's available to them. But I think it's a very individualized choice in, balancing their own unique risk factors and, accessibility to the vaccines. But yes, they are safe for women in their 30s and 40s.
There is actually some data that younger people may have a more significant reaction to all vaccines, not just the COVID vaccine. This is why we recommend vaccinations in children. They have a more robust and a more thorough immune reaction. So yeah, we may see a little bit more discomfort in that 24 hours or so after vaccine for the COVID vaccine. But again, it's typically something that is very easily managed with rest, Tylenol, ibuprofen, fluids, that type of thing.